Right, well, yeah, just want to echo what Kevin said. Thank you guys all so much for coming. I'm very excited to hear from our speaker. I think this is all a topic that we are dying for just more information so that we can be prepared. We have Dwayne Smith with us. I'll let him introduce himself here in a second. I pulled one of his old bios from his Safe Kids days and cut it down a little bit. So Dwayne was the former Safe Kids Colorado State Office Coordinator. He is currently the Public Health Director for Elbert County in Colorado. Dwayne has worked as a health educator for 29 years, which may be more now because this is from an older bio, and has been a leading advocate for child injury prevention interests with government and community-based organizations since 1995. He's a credentialed Master's Certified Health Education Specialist and holds a bachelor's and master's degree in health promotion and behavior from University of Georgia. So welcome, Dwayne, and please feel free to reintroduce yourself and fill in any gaps that I may have missed.
Thank you, Kara. That about does it. I served as a Safe Kids coordinator in 3 different states, in South Carolina and Georgia, and most recently in Colorado. And was looking for, in my role with Safe Kids Colorado, I was at our lead agency, Children's Hospital Colorado, which we do have a partnership, or we did, when I was there, we had a partnership with a Billings clinic up in Montana to get kids that needed advanced care. So yeah, I started this role just in time for the pandemic, almost 2 years ago. So I am a little bit rusty on my knowledge of marijuana and what we did back when, let's see, it was a ballot initiative in November of 2012 in Colorado. We didn't think it would pass. The day after the election day, on the front page of the Denver Post and all the newspapers said it passed, we were like, oh crap, what do we do now? Retail sales of marijuana went live on January 1st of 2014. So we had a little bit over a year to get prepared for that. At the same time, in November of 12, the state of Washington also passed their ballot initiative, and it required a constitutional amendment, I think, in both states. They went live with their sales, I believe, on July of 2014. So it was a lot of back and forth between us at Children's Hospital Colorado and our colleagues at Seattle Children's Hospital. A lot of phone calls saying, what are you guys doing? And kind of piggybacking on each other's thought processes. So, Kara, I don't want to ramble, so jump in anytime when my time's up, and I'll try to get through as much of my notes as I can. I want to start by saying the sky will not fall now that you have legalized recreational marijuana. There's not going to be kids or young adults or middle-aged or older adults consuming marijuana on every corner in every community. That's an important level set there. I would anticipate that cities and municipalities in Montana will have the ability to opt out. In Colorado, the change basically said, if your city, county, municipality wants to sell legal recreational marijuana, you can, but you don't have to. So the biggest example of a big city that opted out is Colorado Springs. That brings with it its own challenges. The kind of bedroom communities in just over the county line will then want to tap into that tax revenue. So you'll see this out migration for people to buy marijuana on peripheral towns and communities. The city of Denver gave a marijuana license to anybody that wanted one. Consequently, before too long, there were more marijuana dispensaries than there were Starbucks. The city of Aurora, which is the 3rd largest city in the state, issued 24 licenses to begin with. And I think those were 4 licenses in each of the 6 city wards. So there's all different types of approaches that local governments are going to take. Another important thing to know is that the marijuana industry will always be 5 steps ahead of public health, of public safety, and prevention advocates. This is a very well-oiled machine at this point. They will use similar approaches and blueprints that big tobacco used back in the day. So it will be a continual challenge to stay abreast of the latest thing that the industry is doing. And lastly, there will still be a black market and a gray market for marijuana. Black market sales are not going to go away. Gray market is not going to go away. And gray market, just to define that, is a marijuana dispensary that looks like a well-run, above board operation. They may even be paying rent and taxes and have all their ducks in a row, but they're selling more than they're allowed to, or they may not be regularly checking IDs for underage consumers and purchasers and things like that. So that runs into a law enforcement issue, among other things. So I wanted to start off talking about surveillance, because y'all are going to need to, if there haven't been discussions already, set up some type of surveillance. And having worked out of the emergency department in the injury prevention program for many, many years, I would suggest starting with emergency department utilization. So that can be as basic as surveillance of ICD-10 codes. And kind of looking at some background, there's a new ICD-10 code that just became effective on October 1st of this year. And it is a code for cannabis use, unspecified cannabis use. So as youth, young adults, older adults begin experimenting with marijuana in all its forms, edible marijuana, flower marijuana, oils, and everything in between. Many of them will not have had prior experience using this drug. So they're going to run into some adverse effects. By and large, what we saw come into the ED among pediatric cases at Children's Colorado, kids are not going to die from, excessive ingestion of marijuana or marijuana derivatives. But in an extreme case, a kid may need a ventilator. And it's certainly, if that's your kid, it's pretty scary. There is another ICD-10, and I'll share these with Kira because they're got a couple digits after the decimal. There's another one that is poisoning by cannabis. That is an accidental, unintentional ingestion. So those of you in child welfare or that deal with families, you're going to see people become more comfortable, parents become more comfortable using this in the home. So anybody that's on child fatality review committees, you'll see polydrug use, including marijuana, in some of these scenes and situations that you come across. Certainly also impaired driving surveillance. So motor vehicle crashes, any other wheeled vehicles, falls in all their forms. Just setting up that surveillance so you can identify what will most likely be at least a small uptick in those types of things. So yeah, getting those ducks in a row. is imperative. That's the first thing I'd urge folks to do. Moving on to public safety and law enforcement. Obviously, motor vehicle traffic safety is going to play an important part in trying to mitigate impaired driving. To the best of my knowledge, there's no roadside test that can be done yet. I know several startup companies in Colorado tried to create a saliva-based test, but it just wasn't reliable and consistently valid. So law enforcement folks, if they're not already trained as drug recognition experts, they're going to need to get trained in that, which necessitates additional funding, both at the state and local level, and there's grants available for that. Pedestrian injuries, particularly in college towns or entertainment districts in some of the larger towns. Bicycles and scooters, I'm not sure if you have kind of the scooter rentals in some of your larger towns, but certainly that's something you can look out for. And also high intensity drug trafficking areas from the law enforcement. Moving on to fire services. This is a tough one. I would anticipate that every available square foot of unused warehouse is going to become a commodity because grow houses are going to crop up. Those are both for legal marijuana operations and illegal marijuana operations. What we saw, particularly in Denver, the cost per square foot of warehouse went from almost, market value to 5 times market value. The folks that are renting or buying these spaces will not invest in making sure that the building is up to fire code. They will put up drywall, they'll put up grow lights, they'll run anything and everything that they need to do, and that frequently turns into just from a fire and life safety perspective, a bad situation. So your codes inspectors and a lot of the other city and county departments that are responsible for inspecting these things are, particularly in your bigger towns, you're going to have to up staff, and you'll probably end up having those inspections done at the end of the day, because once the grow houses start growing, the inspectors, I heard this frequently, they'll come back with their clothes reeking of marijuana, and they'd have to shower at the station and put on a fresh set of clothes. So just little things like that that you don't anticipate you'd ever run into. The other thing, and I'll talk about this when I get to the utilities, even residential spaces, develop a relationship with Montana Power or Northwestern Energy or whoever the local power authority is, utility. Electric bills, if they jump from $100 a month to $1,500 a month, there's a grow operation going on there. That's the easiest way to figure that out, and that is not specific to lower income neighborhoods where job opportunities may not be as plentiful. We've seen grow operations in suburban Denver in $1 million homes. If you got a basement and access to power, a lot of people are going to try and grow more than the law allows, and make a little bit of money on a side hustle. EMS, looking at EMS run reports for incidents involving marijuana. That's another surveillance measure. Moving on to poison control centers. Not sure who is y'all's poison control center. Is it Rocky Mountain or
Yes.
is it? Okay. So that's easy. So they have long been providing surveillance data for calls on inquiries related to marijuana and unintentional ingestions. not only for adults or humans, but for dogs and perhaps other animals. So you can call, and I'll see if I can, I'm not sure if it's the same education person that's there when I was with Safe Kids Colorado, but I'll try and get care of that contact person. You can call and ask them, Kara or anybody else, to run a report on marijuana related inquiries to the 1-800 number by zip code or by county or whatever. And I mentioned dogs because if a dog gets a hold of a marijuana edible, there's marijuana in the home, which means the adults or perhaps the kids are also consuming. So be careful not to dismiss, oh, that was a dog, we're not going to worry about dogs. That's kind of the canary in the coal mine, if you will. Certainly encourage you to map them by zip code or by census tract in some of your larger towns. Survey and school data. So whatever Montana's equivalent is of the Healthy Kids Survey, certainly qualitative interviews, disciplinary data. I don't know if y'all do drug testing in athletics. All good opportunities for sentinel surveillance. Speaking of schools, I was glad to hear that, if I can find a note here, that the legal age was raised to 21. We ran into an unanticipated situation whereby kids that had that were 18, so generally high school seniors or whatnot, either had a medical marijuana card, or were taking for other purposes CBD oil. Schools needed to edit their tobacco-free policies to specifically state tobacco and marijuana. So that's something that will need to be updated and run through or run past school board. Probably be a good idea to do it anyways in a review of those and similar policies and drug policies, but you may run into a situation, kids with epilepsy. There has been shown to be some benefit from most well-known one is CBD oil called Charlotte's Web, made by a company, I think, in Colorado Springs. We had kids that would have dozens of seizures a day that were patients at Children's, and they got on this Charlotte's Web and it reduced to 1 seizure a day. So if that's my kid, or if that's your kid, you're probably going to want to put them on something that increases their manageability of their situation, their condition. So, and perhaps I should have said at the beginning, I can go either way on marijuana. In our local frontier community here, there was a ballot initiative, I think, last year to allow for 1 marijuana dispensary. And the sheriff asked me what my thoughts were. And ostensibly, it's always going to be a tax issue. It's always going to be a revenue issue because I live in a ranching, or I work in a ranching community here. We don't have any business or industry. We've got more cattle than we do people. So tax revenue is few and far between on agricultural zone property. So I said, I can go either way, Sheriff. You know, it's tough to forego tax revenue when your infrastructure is crumbling and your water authority, literally can't keep a lid on the well because it's crumbling. So marijuana, if implemented thoughtfully with appropriate controls, personally, I don't have a problem with it. I've seen it do good for some cities in terms of tax revenue generated with minimal headaches from all the entities we're talking about. Also seen it, lead to upticks in fires and assaults and other things, and that would be the example of Denver. Denver's constantly struggling with marijuana issues day. Looking at regulatory agency data, so in larger cities, the Department of Excise and Licensing, how many marijuana licenses are they issuing? The Department of Revenue, what's the tax revenue being generated? I don't know if y'all have, if your state legislature has come to agreement on what the tax will be on marijuana. It needs to be kind of at a sweet spot where the tax isn't so high that it still is easier to go to black market dealers, but it can't be so low that it doesn't cover all the extra work for all the departments that are impacted by marijuana dispensaries popping up. I talked about public utilities, electric utilities, water utilities. Certainly opportunities for research. I think the University of Montana, I ran across a couple things that they're looking into. So develop your relationships with the researchers in the state. You'll also see marijuana tourism crop up. So as I understand it, marijuana is not legal in Wyoming. So I would be keenly interested in what the town of West Yellowstone has in mind, because you've got all those tourists going to the park who are going to want to partake, and thinking that they're going to heighten their experience outdoors in the park. So probably, if y'all haven't already, reaching out to town officials, elected officials, the city of West Yellowstone. Early on, Denver, I mean, there was a kind of a cottage industry of marijuana tourism where they would literally sign people up like a duck boat tour or something and put them on a bus and take them to a grow house, take them to several dispensaries. It was like a 3 or 4 hour tour. And at the end, they had the opportunity to purchase, like the gift shop going out of the museum, to purchase marijuana edibles or flower marijuana. How are we doing on time? I want to be respectful of time for other speakers.
Yeah, our hope is to open it up around 9:30, 9:35 or so for questions.
Okay.
So maybe about 5 more minutes of information, and then we can see what people want to know, if that works for you.
Sure.
Okay.
So I'm going to jump to making sure the folks on this call get engaged in the public health advisory committees. So one of the things I was on was the Marijuana Education Oversight Committee. And there were several committees, probably upwards of 8 or 10 that were established in Colorado, including a medical advisory committee, a research committee, and on. But the Education Oversight Committee that I served on through the State Health Department was charged with establishing the prevention and education campaigns, a lot of times targeting youth, but also targeting adults who were kind of new consumers to marijuana, which is going to be an important component. There was also a marijuana working group that was comprised of executive directors of state agencies that focused on regulation and policy. There was a marijuana data working group, again, representatives from multiple state agencies, and they were charged with identifying the collection, monitoring, and sharing of data, a lot of which I talked about in my earlier comments. There was a marijuana communications group that aligned communication strategies and messaging as it related to safety issues. Being high while caring for a baby isn't safe. We ran into that a lot in child fatality review, DUI, fire safety, and so on. It is a monumental task to take on this aspect of what will be the new normal for Montanans. So it's a stepwise progression. You're not going to figure it out in a year. You know, you're probably going to be challenged to get to some level of normalcy for probably, I would say, 3 to 4 years, if not maybe 5 years. Something is always going to crop up. But getting regulations and policy, both at a public level, at a private level, even businesses. There was a landmark case of a guy, I know he worked for DirecTV at the headquarters in Denver, and he was wheelchair bound. He had a medical marijuana card. So through a doctor, he had been given a prescription to use marijuana to mitigate some of the challenges he had as a paraplegic. He disclosed that to his employer, to DirecTV. And then one day they decided that since he couldn't pass a urinalysis, they were going to fire him. And it was a real ethical issue on both sides of the employer versus employee issues. So those issues are going to come up. Hopefully there's some case law that you can draw on when it does from Colorado and other states. But in closing, I would say, don't try to reinvent anything. Just look at Colorado, look at Washington, look at California, and see what fits for not only Montana as a state, but all politics are local, and all conversations on this issue are going to take on a local slant. So obviously what might fly in Missoula might not fly in a more conservative part of the state. So it's a challenge, and I'll stop there.
So we will go ahead and open it to questions. If you do have a question, if you could type it into the chat, and then we'll share that question.
While folks are typing in, I do want to touch on, legalizing marijuana is kind of the first step from a policy perspective, but you also need to look at dosing. So I think your law is going to say you can possess 1 ounce of marijuana. Well, 1 ounce of flower marijuana is a lot different than 1 ounce of marijuana concentrate that has a much higher potency. So down the line, you're going to have to deal with potency issues. You're going to have to deal with labeling issues. Prior to legalization of recreational marijuana, when we had medical marijuana, it was legal for someone to walk into a medical dispensary, get their leaf marijuana in a Ziploc bag, and walk out. Once more than half of the marijuana being consumed became the edible variety, probably about 2 years into, so probably around 2016, the data showed that more people interested in medical marijuana. We had to look at labeling requirements. And the last I checked, and this was probably 2 years ago, there was a 7-page list of things that were being infused with THC, the active ingredient of marijuana. It was everything from your, what everybody thinks of as your cookies, your candy bars, things like that, energy drinks, pasta, marinara sauce. How do you label pasta individually? You can't. So you have to look at other options. All of that, thankfully, is established in Colorado and other states. So again, I would just say copy all regs and edit them as you see best fit for Montana.
Okay, Dwayne, we do have a few questions. Todd asked a question, is flower marijuana what it sounds like? Is it marijuana just ground into a flower?
Maybe leaf marijuana is a better descriptor. There are all kinds of different strains of marijuana, from what we jokingly refer to as ditchweed marijuana, that is literally in some places grown on the side of the road, to really just people with degrees in plant pathology and botany and all these other sciences, plant sciences, coming up with these exotic strains. And obviously the more exotic, the higher the price. There's going to be a market for people that just want the ditchweed marijuana for a cheap high. And then there's going to be other folks that are connoisseurs of marijuana. So I make that distinction just to illustrate that there, I mean, there's as many varieties of marijuana as you'd see in a vegetable garden, you know, different vegetables. So, but yes, flower marijuana would be the type of marijuana that is typically rolled into a joint or packed in a bong or a bowl or some other device and smoked that way, or consumed that way, versus the edible variety.
Okay. And what was the result of the landmark case with DirecTV?
DirecTV won. So the dismissal / firing was upheld. And the court sided with the employer.
It's so interesting because you would think that that would run into disability law as well, you know? So.
Yeah, there were all kinds of twists and turns to that. And the challenging part was the employee disclosed that he was a marijuana consumer, and they didn't have any problem with it until, I think, if my memory serves, the company came up with a marijuana policy, kind of an HR policy. And then someone in HR determined, oh, anybody that has a marijuana card that has THC in their body, and you know, THC is stored in fat. It can stay, depending on your BMI, it can stay in your body a shorter time or a longer time. So that also kind of gets into the difficulty of driving while impaired, because you don't know if someone just measuring the THC concentration, whether they consumed that marijuana in the last few hours or 3 days ago. So.
And then we had another question. Has Colorado limited potency in concentrates or other marijuana products?
I believe we have, and I'm not current on what those potency laws are, but I'm almost positive a couple years ago, that because that was a big issue. Once designers of different strains of marijuana started cranking up potency, and you had you know, the most egregious examples were kids, teenagers that were consuming marijuana, whose brains and bodies just weren't equipped to deal with the intensive effects of it. So yeah, I'll try to find some of that legislation and send it on to CARE for distribution. The short statement that we used to say, and you probably heard this, this is not your father's marijuana. This is not 60s marijuana. It is many, many times, or 70s marijuana or 80s marijuana, many, many times more potent. And before I forget, I want to encourage everyone, once a marijuana dispensary opens, go visit it and see what they're doing, see what they're selling, see what their operation is, see how they're identifying that you are of age, how they're separating people. Some folks or some dispensaries only allowed a certain number of people in the dispensary at a time. So they had kind of a separate vestibule or waiting area. And then when someone would purchase and leave, it was kind of a metered entry. Where it really came to the fore for me was, I live in the city of Aurora, unincorporated Aurora, close to 400,000 residents in Aurora. And the Aurora Chamber of Commerce had a business before hours meeting at a marijuana dispensary. And I went to that and, just had the realization that, okay, this is mainstream now. If the Chamber of Commerce of an entity of a city that big is comfortable saying, all you bankers, all you restaurant owners, everybody else, come to this marijuana dispensary and see your business, this latest business, that's as mainstream as it gets. The other thing I would encourage folks to do when they go to a dispensary is ask one of the proprietors, do you sell lock boxes or any other type of device? What are you doing in terms of encouraging parents to make sure, just like other prescription medications or over-the-counter medications, they're locked up and away and out of reach of kids and dogs. The first time I did that, the proprietor said, oh yeah, we got lots of boxes, put them in. So they weren't the lock boxes that I was referring to. They were, in this case, an energy drink that had a laser cut false bottom to it, where you could slide off and half of it and put your marijuana in the bottom of it. There was a Country Time lemonade cardboard canister that had a false bottom to it. Coca-Cola cans. Can you imagine being a teacher and seeing a kid with a Coca-Cola can in school? You're not going to think twice about it, but you don't know what's in the false bottom or if it has a false bottom. And with regard to schools, early on, we heard from educators that they'd see kids eating peanut butter cups in the hallway, not realizing those were THC infused peanut butter cups. And the manufacturers, they actually got sued by the Hershey Corporation or slapped with a cease and desist because their wrappers for their peanut butter cups look just like Reese's. Their wrappers for their chocolate bars look just like the Hershey's bar, and so on and so forth. So unless you are close enough to smell gummy bears that may be THC infused, they don't look any different than regular gummy bears. The dispensary is just spritzing a THC infused oil on the gummy bears. So all those little clues and things that are going to necessitate a shift in, or maybe establishing a more keen eye among a lot of professionals.
So there was a comment that was similar to what you were just talking about. But have you seen or heard a willingness from dispensaries to work with those in the public health, public safety to keep others, particularly children, safe?
Yes and no. So as part of being a member of the Marijuana Education Oversight Committee, the state committee, that committee was comprised of marijuana industry folks, and then on the opposite end, kind of a parents group. One of them is called Safe Colorado. I think it's safecolorado.org you can look at. They are kind of the anti-marijuana, not in my backyard, marijuana, and just really extreme on that side. And then I tried to kind of be in the middle. Responsible dispensary owners want to do the right thing. The problem is, just like there's reliable car dealers and then other car dealers that maybe might not be so honest. It runs the spectrum of, ethics and responsibility. One very well-known chain of dispensaries got shut down in Aurora because there's this process called looping where someone would come in, you can buy an ounce at a time, but you can't walk out, buy an ounce, walk out to your car, put it in your car, come back in, buy another ounce, and continually loop. That's illegal. But they weren't stopping people from looping purchases. And the owner and the investors lost their shirts, millions of dollars, because all these dispensaries got shut down. The bigger names, and you've probably seen celebrities that have gotten into the marijuana industry. The easiest one is Willie Nelson. He's been in it for a long time, both illegally and now legally. He's got his own strain, his own grow houses and things like that. It's a real cottage industry for Willie Nelson. So that's where kind of the surveillance and enforcement from the law enforcement perspective can be helpful, in having that public safety or law enforcement representation on committees to let folks know where the challenges are. Does that help? Did I answer that?
And we have another comment. Can you talk a little bit about some of the labeling requirements that have been enforced in Colorado?
Yeah, so we actually had legislation pass. This is probably at least 3 or 4 years ago, probably around that time. And again, I'll find this and send it to Kira, but there was no symbol, though, no universal symbol that indicated if I'm eating a brownie or a cookie or whatever, that cookie contained THC or was the other products were infused with THC. So through a lot of focus groups and other efforts, the state came up with a red triangle, I believe with the letters THC inside the triangle, and maybe an exclamation point or something like that. And any product that is infused with THC must have that icon on the label of the product clearly displayed so that someone knows what they're consuming. That probably took a couple years to wade through and get really rolling out, because again, it was the Wild West in terms of, you know, what products people were creating and selling in these dispensaries. And, you know, one dispensary I walked into and actually had a opportunity to tour the kitchen, and the baker, no pun intended, said, you know, we bake everything from scratch. But then there's these cookie sheets of, you know, wrapped brownies where they had gone to Sam's Club or Costco and just bought things in bulk, and all they were doing was spritzing them with the CBD oil or otherwise infusing them, and then just slicing them up, wrapping them up individually and selling them. So again, a keen eye, and there should be, I would anticipate there would probably be some, you know, Montana Marijuana Growers Association or Business Association or something like that. You know, invite them to the table. They're an important part because they want to legitimize this. And in Colorado, our ballot initiative, I should have said this at the beginning, how they framed it was the campaign to legalize marijuana like alcohol. And so framing it in that perspective was, well, alcohol is legal if you're over 21, why should marijuana be? And you will learn the further you get into this, there was a lot of misinformation back in the 30s and 40s and 50s and beyond. And I think one of the most famous information media was a movie called Reefer Madness, where it's basically the script was, if you partake in marijuana and other drugs, you're just going to go crazy. Again, the sky's not going to fall, but that's not to say that it's not going to be without challenges.
Then we had another question for you. Who does compliance checks in your state?
Those are left to the local level. For the most part, I should say on the front line, there is a statewide marijuana enforcement division. So and I'm not well versed in exactly what their role is anymore. I want to say it's kind of like a Consumer Product Safety Commission type agency for marijuana. But compliance checks, your larger police departments or municipalities that have the capacity to do compliance checks in the same fashion that you would do tobacco compliance checks to make sure that convenience stores aren't selling tobacco to minors or things like that. Those are going to need to be established. And if it's a grow house or another entity like that, that falls under fire and life safety code. So your fire department would be the entity. And before a dispensary can open, and supposed to be before a grow house can open, all that has to be checked off and be up to spec on fire code. So your state fire marshal's office and your local fire associations, many of which, you know, are volunteer, they're going to need education and training.
And Faith has a great question. Are you seeing movement in Colorado to legalize psychedelics next, or all drugs for personal use like in Oregon?
Yeah, good question. I don't know whether it's 2 years ago, maybe it was the year before the pandemic hit. You know, when the pandemic hit, most state general assemblies had a truncated session, and they were only dealing with the most pressing matters. But at least a couple of years ago, there was a mushroom bill, and I may not be pronouncing it right, the psilocybin mushrooms. And yes, so there is kind of this growth and continuation of now, you know, our foot's in the door, we got marijuana legalized. Let's move on to other mood altering, mind altering substances. Before that, what you'll probably see are either at the local level or maybe the state level, legislation introduced on kind of cannabis clubs, if you will, where people can gather and consume in the same environment that you would for alcohol in a bar. I think those have all been shot down in the Colorado General Assembly. It's not going to stop some other state eventually from, you know, being one of the first to pass that. I'm not sure if other states have or not. I would suspect that'll probably come before kind of the other drugs. But yes, there was at least offhand I can think of the mushroom issue.
Another question, did Colorado see dramatic increase in positive urine test among students, like sports and activities testing, or a large increase in discipline referral for marijuana?
Can't speak to the discipline component. As far as marijuana use in schools, and certainly through the Healthy Kids Survey, where it's self-reported data from kids taking the survey, there was not and has not been a dramatic uptick. And if I recall correctly, I think levels stayed virtually the same. And I want to say in the neighborhood of 18% of kids on the Healthy Kids Survey shared that they had consumed marijuana in the last 30 days. But that was part of the sky is not falling. You know, not every high school kid, middle school kid is going to turn into the proverbial pothead. That didn't happen, thankfully. That's where the education campaign comes in. And a lot of the education campaign is giving, communicating to parents the right, you know, ways and key phrases to have that discussion with your kid. Let's
see. And we just had a question. you kind of already answered that. Are you aware of, or, whoops, it popped up, darn. Are you aware of an increase in reports of marijuana use, the use with the legalization of recreational marijuana? Kind of already answered that. And then we had another comment question. What I've read is use has not increased for youth, but has for 18 to 25 in legalized states. But the potency of the products they've been using has gone way up, and more youth who use are choosing to use the highest potency products like dabs. Is that something that you guys have seen, or has that really been tracked at all?
I'm sure it has. There is a weekly free publication in Metro Denver called Westward. I'll have to get that to you exactly, but fully a third of the pages in that publication, the back third, are marijuana ads. Marijuana ads in strip clubs. It is in Denver. It is kind of that younger, I hate to say younger generation. I'm nearly 56, so I guess it is a younger generation. Kind of the hipster, here's the best clubs to go to. Here's what's, going on, the best restaurants in Denver and other, suburbs of Denver. That is an education in and of itself. And there's a column in this magazine called Ask a Stoner. And it is just like a Dear Abby column where folks write in and say, what do you know about this? Or how do I do this? Or whatever. There are more terms than I am able to keep up with different types of marijuana concentrates. So shatter, butter, dab, and on and on. And some of them are kind of descriptive, like the butter kind of looks like a butter that you consume. The shatter kind of looks like a peanut brittle, and on and on. So if there is some type of publication, or if you were to look at the Denver publication online, it's really a pretty steep learning curve, again, to keep up with all the latest and the greatest. And there are, just like food reviews in the paper, there are marijuana strain reviews. This is, there is so much that can be covered, and there's a lot to learn. So just one step at a time, and try to keep track of, even if it's on Instagram or other social media, just kind of subscribing to those appropriate pages so that you can have a better understanding, or some type of understanding of what the younger generation is talking about, and how what direction things are moving in. And it's also a good way to find out who's planning to do what in terms of opening up a dispensary, or a certain group wants to push legislation or an ordinance in a municipality or wherever. So it's quite a task if I haven't conveyed that sufficiently to this point.
What would you say to, so for instance, my parents are older, they're in their 70s. The comments about the legalization of marijuana is often that marijuana is a gateway drug. Not only are we going to legalize marijuana, but we're going to then see that that's the stepping stone drug to other drug use. Has Colorado seen an increase in other types of drug use in correlation after the marijuana was legalized?
In terms of whether it's a gateway drug or not, I'll leave that to the research. I want to say that there's been a lot of research that have found that it's not a gateway drug. I've also seen, if I recall correctly, some that say it's a little bit of a gateway drug. There are there is some belief, and I don't know what the current evaluation or research is on this. Folks that are inclined to use or abuse substances, marijuana may be a less destructive option than meth or heroin or cocaine or some of the other drugs. So it's not going to cure the meth problem or the heroin problem or the oxy problem. My observation is it's kind of, different strokes for different folks. And there's a lot of other determinants that go into whether or not a person chooses to be a consumer of marijuana versus, some of the other more deadly drugs. So I'm not well versed in the specifics of what you'd like to identify with that question, but I know the research is out there. I'm just not up to speed on what the latest is.
And it looks like that is the rest of our questions, which is good timing since our our meeting is scheduled till 10 today. I do know that we are recording this, so of course we can provide a link, and then maybe Dwayne, if you would be okay with us sharing your email if someone does have questions or thinks of follow-up things later down the road. I know for us, I really appreciate you coming and being able to be here with us. I think you provided a huge amount of information, and that you could be an amazing resource for those that are looking down the road. It does look like a few people have to jump off the meeting. So do you have any, in 20 seconds or less, any final comments or words of wisdom to share with us today?
Yeah, thanks for the opportunity to speak to y'all. Reach out anytime. Happy to serve as a resource. Kara, I'll probably funnel a lot of stuff through you. But yeah, just know that you're not alone. There have been folks that have been through this before. So reach out anytime with questions.
Thank you so much, Dwayne.
Thank
We really
you.
appreciate it. And
Okay.
for the Safe Kids Coalition members, we will table the rest of our meeting items. And Miss Amanda has graciously offered to present her information with Member of the Month at our next coalition meeting, which will be next month via Zoom. It's always the second Thursday of the month at 9 a.m. So for the little bit foreseeable future, we will be on Zoom. That will be January 13th. And I will send out updates. And if you would like a link to the Zoom meeting, we will go ahead and do that as well. So for those of you who attended today, thank you guys so much. We really, really appreciate it. And we will talk to you guys soon.
Thank you.